This is an introduction video to Module 3, the Intra Extraoral Exam. So basically we're going to be comparing between what's healthy gums or the oral cavity compared to what's not healthy in the oral cavity. So I'm just going to talk a little about the first statement. We put on here, healthy tissue does not bleed, and that's true in all circumstances. You, especially, I know as hygienists, we're in there, we're using different instruments, and you might not be using those, but especially when you're brushing teeth, if they start to bleed, that's an indication of an infection, something's going on in there, that we want to get that taken care of. So first we're going to start off by talking about healthy tissue, healthy gums, bone. When we look inside the mouth, we want to see pink gums or pink gingiva all over. If it's, I'm going to come over here to non-healthy. If it's red, if it looks angry, that's a problem. And so we want to figure out what's going on. Going back to healthy, textured, we want that to be stippled. And I know that's kind of a confusing word. We always compare it to kind of like the outside peeling of an orange. So coming over here to non-healthy, if it looks boggy, or another word for boggy is inflamed, that means that it's just really puffy. Going back to the red, most likely if it's puffy, it's going to be red too. So that's a sign of being non-healthy. The papilla is basically the gingiva in between two adjacent teeth. So it's kind of got a point. So on a healthy, we like it nice and pointed. But on an unhealthy, it's kind of blunted. So again, it's a little bit more inflamed. That means that it's angry and it has infection in there. And then the last thing, attachment. We like the gums to be very tightly attached to the tooth. This means that it's healthy, and in a non-healthy state, that the gums could be kind of loose, then again, more inflammation, more things like that. So this is just a little comparison about healthy versus non-healthy. And then also on the flash drive, we've attached type of like a handout, and it's stating a couple different areas in the oral cavity where cancer is most likely found. So you can hand this to your patients, you can discuss it with them while they're there at your appointment, and they can do weekly, however long you think, monthly checks on themselves. They can look in their mouths and check those spots in those areas to see if there's anything abnormal. So just watch the next two videos over the intra and extraoral, and I hope that helps you.
Welcome to Module 3. We're going to be talking about the intraoral and extraoral exam, otherwise known as the oral cancer screening. So we're going to be looking for anything that's unilateral or something that's only on one side of the face or mouth versus the other. So your extraoral exam starts when you bring your patient back to the room. So we're going to have Jessica here. So she's walking into our room. We're looking at her facial symmetry, seeing anything that might be, kind of different on one side versus the other. So we're going to start with the cervical lymph nodes. We're going to be checking lymph nodes and salivary glands and sinus cavities today, as well as many other facial features. So we're going to start down here at the cervical lymph nodes. Lymph nodes are not palpable if they are not enlarged. So most likely you will not feel them unless there's active infection. So we're going to palpate these cervical lymph nodes, and then down by the clavicle as well. And then next we're going to check the thyroid gland. And since the thyroid gland is nestled next to the trachea, we're going to press on the opposite side to push it to this side here, and then palpate with your fingers and feel for anything like goiters or any enlargements. And then we're going to use the other hand to push the thyroid to the other side and palpate. And then next we're going to check for all of her movement with her epiglottis here on the trachea. So you'll just place your hand here, right next to her throat here, and then have her swallow. So we're looking for full range of motion there. And then next we're going to check the submandibular lymph nodes and the gland as well that's there, salivary gland. So we're going to check, use both hands to check bilateral symmetry. We're feeling for any enlargements. And then we're going to move up and check sinus cavities here and just check for any enlargements. and the parotid gland and parotid lymph nodes. It goes all the way almost to the ear. And then next we're going to check the TMJ, or the temporomandibular joint, which is the jaw joint. We're going to place your hands about right here, and you're going to place 3 fingers on both sides, and you're going to have your patient open 3 times, super, super big. What we're feeling for is any popping or any crepitus, which is kind of like a creaking feel. Alrighty, then we're going to check the preauricular lymph nodes, which are right in front of the ear, right here, and we're feeling bilaterally on both sides. And then the postauricular, which is behind the ear here, and that's bilaterally as well. And then down to the occipital lymph nodes. Feeling for symmetry as well, and any enlarged lymph nodes. And then my last step is I always check the hairline and the lip line here for any spots, especially if they're people who work outside for a living. So if you check those areas there for any possible skin cancers. Now that we've concluded the extraoral exam, we're going to move internally to the intraoral exam. One important thing is to switch gloves before you start the intraoral exam, because you've got their facial oils on your gloves from palpating the face. So once we've changed gloves, we're going to have a mask as well. Put that on here. And then for the intraoral exam, we're doing the exact same thing as the extraoral. We're feeling bilaterally and feeling for any bumps or lumps and looking for any possible sores on the inside of the mouth. So we checked the lips during the extraoral exam, so now we're going to palpate the lips. So we pull the lip out, and we're going to use our thumbs and our index fingers to feel around and feel for any abnormalities. We're going to feel the top and the bottom, and this here is called the buccal mucosa. We're going to jump up and feel for anything that kind of stands out. And then the sides, and feel those on the inside. Then we're going to take a peek. You're looking for anything that's unilateral. And then next we're going to jump down to the gums, or the gingiva is what we call it. We're just going to take a single index finger and run our fingers around, and the bumps that you feel towards the bottom are the roots of the teeth. But if you ever feel a bump that's not near a tooth, that would be an area of concern. So once we feel the fronts, we're going to jump to the backs. So the fronts here are called the buccal surfaces, and then behind here, these are the lingual surfaces. So we're going to feel there. And then while we're up top, we're also going to feel the palate, or the roof of the mouth. And I always warn my patients before that it kind of is a little ticklish up there. So Jessica, this might tickle a little bit. I'm going to feel the roof of your mouth. Feel there and there. And then we're also going to feel the very, very floor of her mouth as well. We're going to take the thumb and press gently while using the index finger and middle finger on the bottom. So we're kind of grasping like this and pressing down. So we're feeling both with our thumb and our 2 fingers on the bottom. Alrighty, next we're going to check the tongue. The 2 most common places that we find oral cancer are on the sides of the tongues and the roof of the mouth. So those are super important areas just to take a peek at. So Jessica, can you stick your tongue out for me? Perfect. We're going to use the gauze in a C shape here to kind of grasp the tongue. It gets a little slippery. We're going to check the sides. Use your finger to feel as well. Both sides here. Then we're going to have her say, ah. Ah. And we're going to see those bumps here are normal. Those are her papilla and different taste buds. We're going to check under here. And then Jessica, can you put your tongue up to the roof? Perfect. All right. Next, we're going to check salivary flow. So there is a big salivary gland called the submandibular salivary gland under the tongue, and we're going to take the gauze and wipe the surface right here. And you can actually see the saliva oozing out once you wipe that surface. So she's got awesome salivary flow. And then the next two salivary glands are going to be in the corners here. And that's the parotid glands. So we're going to take the gauze and wipe this side of the cheek up by those premolars. And we're going to look for oozing saliva. And then we're going to check the other side as well. Wipe, and perfect. And then two other areas to check as well is the maxillary tuberosity, which is a little pad of tissue behind her top molars in the very, very back. So we just take our index finger and feel there, and on the other side as well. And then the retromolar pad, which is the same piece of tissue but on the bottom of her mouth, her mandible. Down here, way back in the back. And perfect. So that concludes the intra and extraoral exam, and we will see you in Module 4.